Thank you for staying with us. Let's get into the conversation. We are talking about the importance of regular health checkups and trying to look at the benefits of preventive and routine screening. And on set with me right now is Dr. Wesley Andota, and he is a family physician at the Kenyatta University Teaching, Referral and Research Hospital. He's here to let us in on all of that. Welcome to the show.
Thank you, Yvonne.
You called me Yvonne. I told you so many times. We practiced. It's Vivian.
Thank you, Vivian. Good morning, Vivian.
You're welcome.
Good morning, Kenya.
Good morning. All right, now let's first begin with describing who a family physician is so that we begin our conversation from that.
Good. So, Yvonne, a family physician
Vivian
is this specialized doctor who takes care of the health issues of the family, everyone in the family, every individual, and gives a holistic approach to health care. While a pediatrician takes care of the small babies, an orthopedic surgeon takes care of your bones when you are unwell. The family physician integrates all that to give you a holistic approach to care throughout your life cycle. Yes.
All right, so that's who a family
So the family
physician
is the doctor who every citizen should have their direct line. This is the doctor you should always contact when you have any health issues. Yes.
Okay, that being said, when you talk about preventive healthcare, what are we looking at?
First of all, health is not just the absence of disease. Health basically means when you have the physical and mental and psychological well-being, meaning you're not just surviving, but you're able to function effectively in your daily life. So when you're talking about health checkups, just the same way, you have to service your car. You don't wait for the car to break down before you service it. So we need to give the same attention to our bodies. So health checkups are very important to make sure that as you live along, you're able to maintain that proper well-being. Yes.
Yeah, you're recognized as a champion for community wellness, you know, and you're passionate about disease prevention and also health promotion. Maybe if we just get to understand and get to know you better, where exactly did all of this stem from? Is there a pivotal moment in your life that made you decide this is the area where you want to focus on, and mainly community?
Yes. So growing up, I always wanted to be a doctor. And at some point in my high school, we lost our grandmother, and she died of cancer of the esophagus. I watched how she went down with the disease, how the health-seeking behavior was difficult, how it was not possible to get her the best care she required. And from that point, I decided I'm going to work in the communities, because that is where the disease starts. The disease originates from the community, and if you catch it right in the community, you're able to handle it easily. So it is at that point that I decided I'm going to work in the communities.
Yeah, closely with the communities. Now, what are some of these diseases that can be detected way earlier and would help, you know, alleviate some of the problems that one may eventually have, and if it was detected earlier, it would have worked better?
Now, if you look at the health statistics, you find that non-communicable diseases and cancers, including cervical cancer, prostate cancer, cancer of the breast, are some of the diseases that cause the highest number of deaths in the world. This is up to 7 out of every 10 deaths are caused by diseases that, if caught early, can be prevented. The #1 leading cause of death in the world, and in Kenya as well, is heart diseases. And you know, these heart diseases don't just happen suddenly. They start developing slowly and slowly. The same way the body is made up of very small cells is the same way those cells start changing in the form of disease. So if you're able to catch diseases of the heart, diseases like blood sugar, high blood pressure, we are going to be able to control a lot of the expenses we have on healthcare, and also to prevent a lot of deaths. So high blood sugar, high blood pressure, cancers, all types of cancers for both men and women are diseases that can easily be prevented.
So how often should we be going in for screening?
Now, it is recommended that everyone should attend health screening annually. That is everyone. But now, for specific diseases, for example, for our sisters, the ladies, we recommend that you do cervical cancer screening from the age of 25, breast cancer screening from the same age, and for the gentlemen, we recommend prostate cancer screening from the age of 40. Yeah.
So from the age of 25 for ladies, yearly, you should be going for screenings every year.
Yes, but we recommend that everyone should go for at least a high blood pressure test, should go for blood sugar tests, and cancer screening annually. Yeah.
Each year.
Each
So
year.
maybe we should put it down somewhere. Every time we're celebrating our birthday, you give yourself the gift of going to the
That would
to
be
a
awesome.
healthcare facility
That would
and
be awesome.
get checked.
Yeah, I see some people decide to do their health checkups as the new year turns, and some of them during their birthday. So it is recommended that everyone should at least have a comprehensive checkup annually.
Yeah. According to statistics, most people don't do that. You know, most people in Kenya do not go for checkups. We wait until there's an issue. We wait until there's somewhere aching. And if I won't go get over-the-top counter medication, but mainly we do not go for checkup or screenings. Is there a particular reason why maybe you feel, or is there something that hinders us from getting to that point where we are a nation that actually goes for checkups as it's needed yearly?
Now, there's a myth that if you are not feeling anything, or if you're not unwell, you should not do a medical checkup. Now, you look at the body is made up of very small cells, microscopic, that can't be seen by the eye. It does not mean that if your eye cannot see it or your body cannot feel it, it is not there. Take, for example, cervical cancer. It starts as a very small cell on the cervix, and it grows and grows and grows. So the fact that you cannot feel it does not mean it is not there. Look at high blood pressure. It starts very slowly, and by the time you're feeling the symptoms, it is already at an advanced stage. So we want us to catch these diseases early enough, because see, a case of cervical cancer, for example, if you get it at the beginning stage, the treatment is very fast, very cheap, and very effective. But unfortunately, if you're going to catch these diseases in their later stages, it is expensive to treat, and sometimes, unfortunately, impossible to treat. Yes. So we want to catch these diseases when they are in their early stages.
Yeah.
Yes.
Would you say that the cost of health in the country is among the reasons that are maybe hindering people from going to the doctors as regularly as we should?
That is partially true and partially a myth. Look at example, we have the Social Health Authority that pays for these medical checkups. Yeah. And then we have these other insurances, the general insurances. They also have a package that covers just for checkups, because they have come to realize that it is cheaper to catch these diseases early. Yeah. So if you look at the cost of treating diseases vis-a-vis the cost of prevention and early detection, you find that it is way cheaper to catch this disease early. So this is a case of literal a stitch in time saves 9. Because if you're going to get this disease in the early stages, you'll be able to deal with it effectively. Just last week, we had one of our doctors talking about a case of a lump on the back of a gentleman he was attending to. Unfortunately, this gentleman presented to hospital when the lump was already 15 kgs. Yet it had started 2 years ago as a very small lump. And if this man would have gone to the hospital, the treatment would have been easier. In fact, the doctor said the treatment would have been done in the outpatient setup, just some small anesthesia and excision of that mass. But now when he came to hospital late, it meant that this gentleman has to be admitted to theater. It has to be a major surgery. He had to receive a blood transfusion, and most likely will need plastic surgery after that mass has been removed. Yeah. So if you look at the cost, it is actually a myth that health checkups are expensive. If you compare the effect of catching this disease in its later stages.
Now you have to treat
it. So we have to catch it early. Yes.
Okay, I want to engage our viewers and remind you that our WhatsApp line is open, 0716 103 301, 0716 103 301. If you've got any question for our doctor this morning, you can shoot the message to us and I will be posing that question to him so that he can be able to answer it. As you also let us know if you are among the culprits who never go for checkups. So how often do you go for your checkups? Do let us know. Now, Doc, maybe there's someone who's just getting into this conversation, listening into this conversation, and you know, just from what you're saying, prevention is always better than cure. It's even cheaper, you know, than cure. And they may be wondering if, or what are some of the screenings that they can be able to do using their SHA, Are there, are all these screenings, are they supported by SHA? Like, can I go to hospital and use my SHA to do the cancer screening, to do this screening, that screening?
Yeah, so the government has been proactive in the fight against some of these preventable diseases. Say, for example, we have a national preventive strategy that says, for example, cervical cancer screening, SHA is going to pay for that simple pap smear. A pap smear is a simple procedure where some cells are taken from the cervix and screened for any abnormalities. The government pays for that, and it is available in most of the public hospitals and clinics. So yes, it is available.
Yeah. Okay, so it's available. We don't have any excuse for not going to get checked. Yes. Now, I think it's also something to do with our culture. We normally, as a people, we're just used to, just being, as you were saying, you say, if it's not broken, why try to fix it? Whatever you don't know won't hurt you. There's another one that says, if I don't know, then what's the need of me getting to know something that is going to be that is going to hinder me in one or the other. So there's that mindset. Is it a culture thing? And can we be able to revert that?
So thank you, Vivian. Here we are talking about our nation's health-seeking behavior. The health-seeking behavior basically means what you do on matters health. There are those who choose to pray about it. There are those who choose to self-medicate. There are those who come to the hospitals. There are those who seek alternative medicines. We even have some of us who seek the services of witch doctors. Now, our health-seeking behavior, of late we are seeing a drastic shift, especially with the government efforts. For example, with the deployment of the community health promoters, they have been able to disseminate information into the communities, and we are seeing a drastic shift in how we seek for health services. Ideally, you should seek for health services from qualified professionals, but still, for some reason, maybe because of culture, maybe because of religion, maybe because of financial constraints, we find people not taking the right channel to seek health services. Now, we have places in this country where health services are not accessible. Not just accessible, but maybe not even available. So that could as well hinder the accessibility of these services. But yes, we need to encourage our people, when you are sick, when you think you are not sick, it is time to visit your health facility for these checkups. Yes.
How do we go about dealing with the barriers that are there?
Now, the biggest barrier we have, I would say, is the lack of information. Our people don't know what to do. So we need a lot of advocacy, for example, what we are doing right now. We want to inform our people about how to seek health services, what to do when they are unwell or when they are well. So we need to do a lot of advocacy and let our people know exactly what to do. Finances are also an issue, but I can see the government has gone out of its way. The Social Health Authority trying to cover the deficits that we have for those who cannot access services. Recently, we saw the government say they're going to pay for those who cannot afford the Social Health Authority premiums. We also want to encourage our people because of the cost of healthcare. It is good to have health insurance. The government health insurance. You can also take private health insurances to cover you in cases of health disasters. We also want to tell our people, without health you cannot function. Health should be everything. We should incorporate health into all our activities. We have seen countries who take health seriously. We see their health systems are strong. We see them talk about health in every forum they get, because of course when you're not well, you're not able to function.
Speaking about that, maybe what are some of the everyday habits that can help us as a people stay ahead when it comes to preventable diseases?
Good. Having this conversation should be one of the starters of having a healthy nation. For example, Vivian, when did you last do your health check?
Wow.
You see, this is a simple
I'm one
question.
of the culprits, yeah.
We see you.
Unfortunately.
Yeah. So you see, this is a simple question that can actually save lives. If you ask a family member, when did you last do your health check? It is going to prompt them to start thinking about their health. And you know, taking care of your health and mastering your health is simply taking care of your future. Yeah. So having these conversations, we want people to be talking about it, make it part of your everyday conversations. Like when you get to the office, good morning team, how are you feeling? How is everyone at home? So we want to probe that because we know health is not just the absence of disease. It is the physical, mental, and social well-being. So these conversations should be had. We also want to encourage people to live healthy. Yeah, you know, you as an individual, you are your own first doctor. You're the one to take care of yourself. Yeah. So as an individual, take charge of your diet, eat healthy, make sure you do exercises. Yeah. Make sure you avoid overindulging. Substances like alcohol and cigarettes do direct harm to your health. So we want our people to stay healthy. We want us to have a healthy nation. We want to have people who walk. We have seen in countries like Rwanda, they have a car-free day where everyone leaves their cars at home. You either take your bicycle or you walk to work. Yeah. So physical exercises in every moment you can is one of the ways of staying healthy. And of course, doing your regular checkups. We have to schedule our checkups regularly.
So the initiative to start by yourself should be taken by each and every person. It is up to you to care for yourself. It is up to you to ensure that you are healthy. Although sometimes they say you can never be too careful, but I mean, you can do the steps that would help you with your health journey or good health. And I love the fact that you've talked about lifestyle, because I feel like right now it's a big issue, if I may put it as, you know, in quotes. It's a big issue because, as you said, people don't walk anymore nowadays. Watching what we eat is not really much of a priority, maybe. So it's important that you've actually pointed that out, that, you know, the daily things that you can be doing, one thing every single day that would help. As they say, an apple a day keeps the doctor away. Not directly, but yes, exactly that. Now, when it comes to the screenings, still, I know you've mentioned on the screenings that women over the age of 25 should ensure they take. Men over the age of 40, the prostate cancer screening, and the regular checkup for every adult when it comes to your sugar levels and maybe your high blood pressure and all of those. What maybe are the screenings that, or are there specific screenings for younger children that parents should ensure that their children also go get screened for them?
Thank you, Vivian. Now, as a family physician, we take care of the individuals right from birth all through the life cycle. Now, for babies, we usually have the screenings that we do immediately after birth. The pediatrician is going to examine that baby and note down any deformities or any problems that they may encounter at that point. We also have the examinations that we do as the children approach puberty and also as they enter into adulthood. So yes, even the children are always screened for possible genetic malformations or any diseases that present in childhood. And of course, whenever you have symptoms in a child, always take them to a specialist. You know, sometimes most of these diseases, they appear the same. Something that might appear like a headache might be something much more serious than a headache that you can self-medicate at home. So we want our people, whenever there's any health issue, any health concerns, always have it checked by a specialist. So we want to see a more drastic shift in our health-seeking behavior, where we don't just assume, health issues. We don't. Yes, we can pray about it, but you know, God answers prayers through people. So when matters of health are concerned, God answers prayers through the health specialists. So as you pray to God, God is sending the health specialists to deal with them. So come to the hospital, come to the health center, contact your nearest healthcare provider for any of these health issues.
There's a question here. It's saying, what is the timeline ya mtu wa CDK? Mwambie huu ni mwaka wangu wa 10 nikiwa kwa dialysis treatment.
CDK basically means chronic kidney disease. Yeah?
Yeah.
As we had said before, most of these diseases start slowly. By the time we are talking about chronic, it means he has had this disease for quite some time. Yeah, means the kidneys have failed. And you know they don't fail in a day. They start failing slowly. By the time you realize they have failed, it is quite a damage. So chronic kidney disease is usually managed by our specialists. We call them the nephrologists.
Yeah.
Sometimes the kidney is so damaged that we have to get a replacement kidney. So what we do, kidney transplants. And for the meantime, we usually do dialysis. The function of the kidney is to wash blood, to clear out any impurities in blood and any excessive items that are not required in the blood. So chronic kidney disease can be managed by dialysis, kidney transplantation. But now he wants to know the timelines.
Yeah.
Meaning for how long you can be on dialysis.
Yeah.
This
They've
is
been
individualized. Yeah?
in dialysis for the last 10 years.
For the last 10 years. Healthcare is always individualized. We cannot say that someone can suffer for this disease for only 5 years. Sometimes a disease is so well managed that you find that what takes you out is not even that disease. Yeah? You can even die through an accident, yet you had chronic kidney disease. Yeah? You can find a healthy person getting another disease that takes them down faster, yet the chronic disease is still being managed. So with proper management, we always improve our we improve our lifespan and our quality of life. So I want to encourage the one who asked this question. Keep taking your medication, keep doing your follow-ups, and it shall be well. Yes.
All right. Let's talk about over-the-counter medication.
Yes.
Nasikia nimeumwa na kichwa kidogo, nimeenda pale nimechukua dawa tu. Nasikia, oh, I think, you know, I'm just feeling heavy. I just go get medication over the counter. You know, I don't go get checked to know what exactly is happening. If you can just speak about that, because I feel like that is something that most people actually do.
Now, this is one of the biggest problems facing our nation in matters of health. Self-medication and over-the-counter treatments.
Yeah.
You see, the body works as a system.
Yeah.
So if you're having, for example, a stomachache, you will have pain. But now you see the abdomen has so many organs that just taking a painkiller for the stomachache limits the kind of treatment you are getting. So we don't encourage over-the-counter treatments so much because most of the time we are not treating the correct thing. Yes, it may work, the pain may go away, but now what are you treating? You're having a headache. You know, there could be a million reasons why you're having that headache. Yeah. So we want to have a shift of mindset over the counter treatments. We want our people to focus on the proper treatment. Yeah. Don't self-medicate unless you're very sure on what you are treating. So always get a prescription once the diagnosis has been found, so that we know you're treating the correct thing. We'd also want to urge the government to be a bit stricter on these chemists that just dish out medicines. Yeah? You find some of these medicines are controlled. Some of the side effects are really harsh, and it is important that they are followed up closely. Yeah? So we want people to be a bit more serious with their health. Don't just take any medication. Another issue is the issue of herbal medication. You see, when we give you a dosage of a medicine, say for example Panadol, take 2 tablets 2 or 3 times a day. That drug has been titrated, it has been compressed in such a way that we know the exact amount you are taking. But now when you are taking a herbal medication, we don't know when you are crossing the overdose, we don't know whether you are poisoning yourself, and sometimes we don't even know if it is the correct medication. Yes. So we really want to discourage our people from over-the-counter and self-medications. Yeah, because currently we have specialists to take care of us. Yeah, so come to the hospital, come to your clinic, and we'll give you the correct treatment.
Yeah, and on that, allow me to add, there's a time we had a doctor here on set as well, and she got to talk about the miti shamba, ama mitini dawa, you know, and she actually mentioned that, yes, you could take that miti shamba and it works,
Yes.
but you don't know what else it's doing
Yes.
to the body. Maybe it's affecting your kidney in one or the other, and you are taking it for fibroids or for this or that. So it's really just important to just go to the right people. People have gone to school for this.
Yes.
Go to them and get to know what you may be ailing from. Now the messages are coming in. I will get into reading them. In case you you have any question for our doctor this morning, you can send in your questions 0716 103 301 0716 103 301. Someone is saying many people avoid checkups because of trauma after knowing their status. So what do you advise them? You know, people who avoid checkups because of the trauma that comes afterwards. Let me read a couple of them and then you'll get to answer them. Someone here is saying, hello, this is John Karaoke, Records Officer at the Wellness Center, KU Referral. Thank you, Dr. Wesley, for the work you're doing. My question is about under 18 years, if they can do annual checkups as well. Good morning, Dr. Wesley. Your team and you are doing a great job at Wellness Center at Kenyatta University Teaching and Referral and Research Hospital. This has enabled early detection of non-communicable diseases. This one is just to give you your flowers on the work that you're doing. That is Eunice Maina. Another one is asking, morning, Vivian and Doc, how are skin tags on pubic areas treated? Maybe if you can get into those ones.
Good. Now, one of our countrymen has asked about avoiding health checkups because of trauma.
Yeah.
Now, if we get this disease early enough, the trauma that you have at that point cannot be compared to the trauma that you're going to get if we get it later. So the earlier, the better. Yeah, yeah. So we want to encourage our healthcare providers to be humane to our people, because that question basically means someone went for a checkup and they were given the diagnosis abruptly. Maybe they were not prepared for the heavy news, and therefore they felt traumatized.
Yeah.
Yeah. So whatever the case, if we get whatever diagnosis you get, we're going to be able to handle it. Yeah. So we want to encourage you, irrespective. Yeah, get some courage, irrespective of the outcome of your checkup. We're going to handle it. This is you taking care of your future. This is you taking charge of what is coming ahead of you.
Yeah.
So whatever the diagnosis is, be rest assured we're going to handle it in the best way possible. Yeah. So come, we'll take care of you.
Okay.
John Kariuki. From the Wellness Center at KUTRH. Thank you for your question. Yes, under 18s can also undergo these health checkups. Yeah, we've seen screening going on in schools. We've seen cases of disease prevention in even primary schools. Like the government has a very comprehensive disease prevention mechanism called the National School-Based Disease Deworming Program, where children under the ages of even 15 are undergoing these checkups and being given preventive measures. We have even seen, when matters of cervical cancer, we see our girls under the age of 14 being given the cervical cancer vaccine. So yes, even those under 18 can undergo these health checkups. Eunice Maina, I know she's watching us all the way from the United States of America.
Oh.
Thank you for the compliment. We'll keep doing the best we can do. One of our viewers also asked about skin tags in the genital area. Please come to the hospital. We're going to take care of it. Yeah, yeah. You may assume it's just a skin tag, and it could be a skin tag, yes, or it could be something else. Yeah. Either way, come. Let's have a good look at you, and we'll take care of you.
All right, very well answered. Maybe I can read one more here. Someone is saying, hello, Daktari, I wanted to inform you that I went for an eye checkup after experiencing blindness in one of my eyes. The doctor at Kenyatta Hospital assessed my situation and mentioned that recovery is unlikely. Although it doesn't cause me any pain, I can only see shadows when I wave my hand in front of the affected eye. Could you please advise me on the next steps or any potential treatments? Your guidance would be greatly appreciated.
Very well. It is good that this viewer went to the hospital for that checkup. Diseases of the eye are usually handled by eye doctors. We call them the ophthalmologists. So they do a comprehensive check and find out first the extent of the disease, and even probably the cause of that disease. So depending on the cause of that disease and how it has spread, they're going to give us advice on how it can be managed. We have cases where we have to do counseling so that we can accept the outcome of the diagnosis. If, for example, the eye cannot be salvaged, we have to do counseling and prepare our people on how to reintegrate into the society. How to reintegrate into the society with now reduced vision. We also have support where, in cases the disease is advanced, sometimes we may have to do an amputation. This basically means we may have to remove the eye and probably do a prosthesis. So for the person with the eye problem, it is good that we are at this stage and the doctors are going to take care of you. Yes.
Okay. Keep sending in your messages. The doctor is here just for you. Now, what role would you say communities have, or what role do communities play in promoting preventive health?
Yeah, very good one, Vivian. You see, we all live in communities, and it is in the communities that the disease starts. Everything originates in the community. Our food is in the community. Our lifestyle is in the community. Our families are based in the communities. So the community actually plays the biggest role. In fact, in levels of healthcare, the community is placed as level 1 and sometimes level 2, depending on the speciality. So the communities play a very big role in matters health, and we want to encourage our people. Have these conversations in the community every time you're in the market, every time you're having a chief's baraza, every time the politician is doing his campaigns. Let us talk about health. So the community plays a very big role. And we want to applaud the government. Recently, we saw our president flag off more than 100,000 community health promoters. This basically means they're going down into the community where the diseases start, and they're going to work from the communities. We have also seen some collaborations from non-governmental organizations that work directly in the community. We have an NGO currently in Bita looking at bilharzia. We have several others, very renowned, international ones. They are working around cases of cholera, cases of malaria, supporting our counties, and basically encouraging the communities to take charge. So the community should take charge of their health. That is where everything begins. Yes.
And I love that you've touched on community health promoters, because they play a really big role in our communities, and we should laud them. There's a message that has just come in. Sema ambia doc asante kwa kujibu swali langu na kwa kunitia moyo.
Good.
All right. What impact have you seen, preventive screening have, in the years that you have been in this line?
Yes. Now, previously, our nation was focusing on curative healthcare rather than preventive healthcare. But we have seen this shift where now we are working on mostly preventing diseases, promoting matters of health. And there has been a significant change. If you look at our national statistics from the Ministry of Health, we are having diagnoses of up to 42,000 cases of new diagnosis of cancers in our communities. And this comes up to about 27,000 deaths, and this is annually. So when we focus on disease prevention and disease promotion, we find that the impact on the healthcare system is magnanimous. We are able to see a reduction in expenditure of healthcare. Our health expenditure reduces drastically because we are able to capture these diseases early, and therefore the cost of treatment is lower. We find that working in the communities and doing preventive and promotive health strengthens the health systems. So yes, there's a big impact on doing preventive rather than curative health. We have generally a population that is lively, a population that is well informed, and largely healthy population.
Okay, I want to read as many messages as I can. Another one here is asking the question of, can brain tumors be removed without the casualty dying, and which part of the brain does it grow and affect most, and why do headaches become severe? Another one here saying, Kibet Mario in Kapkejui, Nandi, I heard that Ramban urinating leads to bladder problems. Is it true? Hello, I'm Joseph. I need to see a gynecologist. can he connect me?
Good. I'm glad that the nation is tuned in and they are following the conversation.
Yes, sir.
So about brain tumors, if they can be removed without someone losing their life. Now, it will depend on where the brain tumor is, and it will also depend on the extent of the disease. Catching these diseases early makes it easier in dealing with them. So small brain tumors that are easily removed can make our work very easy. Yeah, the treatment can be easy and very fast. Now, survival of a patient during surgery depends on several factors, and the main one is the extent of the disease. Yeah, early diseases basically means the prognosis, which is how the disease progresses, is better. Yeah. So on the brain tumor, we will have to look at the individualized case to know exactly the age of the patient, which brain tumor that is, and the progression of that disease, for us to be able to say whether it can be removed or not. Yeah. So that decision is individualized to that patient. Yeah. Kibet calling, asking a question from Nandi, asking about if rampant urination damages the bladder. First of all, Kibet, thank you for asking that. I would like to turn that question and say rampant urination is probably an indication of a problem. And that problem could as well be the bladder itself. So it is not the urination that will cause damage to the bladder. It could be damage to the bladder that causes the rampant urination. Yeah, it could also be something else. Diseases like high blood sugar will give you excessive urination. So Kibet, please visit the nearest health facility for a proper assessment, and then we are going to work out on the treatment modalities. Joseph wants to see a gynecologist. Yeah, most of our county hospitals have gynecologists ready for you. Yeah, depending on where you are. We welcome you. If you are in Nairobi, Kenyatta University Teaching and Referral Hospital has some of the best gynecologists world over. Karibu sana, we are going to take good care of you. So yeah, depending on where you are, Joseph, yes, gynecologists are available.
Okay. Now, before we come to a conclusion of this discussion that we are having right here, can you talk about some of the success stories that you've gotten to encounter, you know, in your area of field that actually, you know, loud the fact that prevention is always better than cure? I know with doctors you have the confidential, so you don't need to mention the names, but just give us the stories.
So there's this friend of mine, he currently works in South Sudan. I will not mention his name, but he's a good friend. He's probably watching us. Yeah. So his family member had a case of cervical cancer. Luckily, we got that disease very early, and it's been now around 2 weeks that the surgery was done. One of our gynecologists did the surgery, and the treatment is complete. Yeah. Had we waited for longer, this disease would have spread. But because of early screening and taking charge of our health, we were able to catch it at stage 1. Yeah. And the treatment was very easy and complete. So that's a success story I would like to laud, and also to encourage our people to always look for ways to catch the diseases early. At Kenyatta University Teaching and Referral Hospital, we have a dedicated wellness center where people come just for health checkups. And yes, we have caught cases of high blood pressure and high blood sugar, that is diabetes. We catch them early and we put people on treatment. And sometimes the treatment does not necessarily mean surgery or medication. Just an advice on lifestyle changes. Like recently, a week ago, we had a gentleman who had high blood pressure, and all we needed to do was to advise him. Stop your cigarettes, do your exercise, adjust your diet, take your water, reduce your salt, eat healthy. And as we speak now, we are seeing a big change in the kind of parameters he's presenting with.
All right. Unfortunately, our time is up. There are very many other questions. We'll figure a way of how you can get to answer these questions outside this session that we are having right now. But thank you so very much for coming through to the show. Thank you for answering the questions that Kenyans are having concerning their health. And thank you for lauding the fact that we should make it a routine of us going for screenings at least once a year, even if you're feeling okay. So Doc, maybe your final remarks?
Now, let's take charge of our health. Yeah, taking charge of your health basically means you can control your future. Yeah, let's make health screening part of our daily routine. Let's make it part of our schedule. Let's not do it only when there is a problem. So at Kenyatta University Teaching and Research Hospital, we have a dedicated wellness center where you can walk in and book for your screening. We have comprehensive packages that we've tailored to different genders. We look at the common diseases. The common diseases we have, the high blood pressure, high blood sugar, the cancers, and we're able to detect these diseases early and start treatment early. And if there's no disease detected, remember, when you have that information, you feel empowered to take care of yourself. So we want a healthy nation. We want a nation that takes charge of their health.
All right.
Yeah.
And this is where we call it a wrap right here on Good Morning Kenya this morning. That was Dr. Wesley Andota, who's a family physician at the Kenyatta University Teaching, Referral and Research Hospital. My name is Vivian Degwa. For everyone who has gotten to make this show a success, we want to wish you a lovely day. Do enjoy the rest of your viewing. Goodbye.